I'm LeMaster. Welcome to my Common Sense Living podcast, where I'm going to add common sense and value to your life. So get a pen and paper because you're going to want to take some notes today. There's a totally reversible disease very present in society, and the ability to eliminate or diminish it is right under our noses. You know what that disease is? It's diabetes, specifically type 2 diabetes, insulin resistance, metabolic syndrome, Syndrome X, obesity, prediabetes, and type 2 are all closely related and caused by similar dietary lifestyle habits ingrained in modern societies. I'm a nurse, certified health coach, and educator. My own grandmother died of complications of diabetes, and I promised myself I would never get it. Thus, my quest to improve my own health by implementing the changes necessary in my life that I will share with you in my upcoming course, Taming Diabetes Differently. Even the doctor was impressed with my success. Diabetes has skyrocketed to epidemic levels and getting worse every day. There's about 2 million cases diagnosed a year, and numbers are increasing annually. It's expected the number of Americans with diabetes will increase from 29 million currently to 44 million by 2034. That's just 11 years from now. It's not just in the U.S. Diabetes is a worldwide issue. Roughly 1 out of every 2 people, or 50% of the world population, have undiagnosed diabetes. 1 of 4 people in the U.S. currently have what is called prediabetes, a condition that occurs when blood sugar is higher than normal but not high enough to qualify as full-blown diabetes. These numbers are determined by a fasting blood sugar level of 100 to 125 milligrams per deciliter. Most people don't know they have it or how to prevent it. Major dietary and lifestyle changes are necessary to slow diabetes and implement cost-effective preventions and treatment to reverse this trend. Most diabetics, especially newly diagnosed, find themselves in a helpless and confused situation at the mercy of their doctors and conventional health care. They end up in a downward spiral of helplessness, health issues, and depressing treatments, clueless as to how to maintain good health or to know they have the power to reverse this condition. That's where I can help you. It's my opinion, conventional medical equipment or medical treatment, pharmaceutical companies, and the commercial food industry are misleading the public with their diabetes treatment recommendations. What your doctor told you about diet is not what you're going to learn from me. My passion is to educate those concerned about this disease that it can be totally prevented, even reversed in some cases. It's a painful or hard to follow. It isn't a painful or hard program to follow either. The most important thing I want you to realize is type 2 is not a death sentence. It's both preventable and reversible. Diabetes is so common, it's a household ailment. It's directly tied to significant increase in heart disease, heart attacks, deadly strokes, and other issues such as high blood pressure, blindness, kidney disease, nervous system disease, wounds, infections and amputations, dental disease, pregnancy complications, and birth defects. Prediabetes is a fasting blood sugar of over 100, and full-blown diabetes is 126 or higher. When we eat sugar-spiking foods, especially fructose and carbs, they become fat cells, and we wonder why we keep getting fat while drinking diet sodas and other artificially sweetened so-called foods. Not only do these fats get stored on our body, but in your liver and pancreas. Your pancreas is essential for controlling your blood sugar. It produces the insulin necessary to control blood sugar. That's why I question the rise in medication doses, which releases more insulin. Doesn't that make the pancreas wear out? So are you or someone you know dealing with blood sugar issues like diabetes? You can lower, even reverse these issues. I lowered my A1C from 5.9 to 4.9 in just 6 weeks. My doctor was impressed. I'm a nurse, certified health coach, and educator. Gift yourself or another with this course, Taming Diabetes Differently. Change your life and theirs. Contact me, LeMaster, at tamingdiabetes@yahoo.com or call 972-948-9976 and be sure to leave a message. So treating diabetes is extremely profitable to the healthcare industry. Doctors, dietitians, pharmaceutical companies, hospital and treatment centers caring for people with the disease and the complications of the disease. Conventional type 2 diabetic treatment is a huge moneymaker, so your chance of a cure from a conventional medical system is pretty much nil. A diabetes patient is a long-term patient with big profits for the healthcare system. How unfortunate for you. I see our healthcare system as a for-profit system and big business. Diabetes is a very costly disease, not only emotionally, but financially as well. The average type 2 diabetic spends around $6,700 in healthcare costs annually. It's expected to climb into the trillions of dollars. Newer medication recently on the market costs as much as $800 a month. Conventional treatments turn their attention to treating just the symptoms of high blood sugar instead of going after the true cause of the disease. Most medical treatments focus on controlling blood sugar by raising insulin levels, although this method may actually worsen the underlying issue of metabolic miscommunication of the hormones that govern blood sugar, appetite, insulin, and fat storage. Does this even make sense? Glucose-lowering drugs have actually been shown to increase the risk of death and don't prevent dangerous complications of diabetes. Patients often get lulled into a false sense of security, thinking they don't really need to watch their sugar and carbs intake, as the drugs will take care of it. Diabetes can age you prematurely and shorten your life. Chances are it's worsening over time with conventional medical care is almost a certainty. Diabetes can age you prematurely and shorten your life. Chances of it worsening over time with conventional medical care is almost a certainty, since the meds used to control blood sugar also cause weight gain. Conventional treatment begins a downward spiral. You gain weight and become more diabetic, more meds are prescribed, and the doses keep going up. The only way to break free of this is to drastically make dietary and lifestyle changes. Your diet will make or break your efforts of restoring your health. If you are pre-diabetic or diabetic, drugs alone will not work. Unfortunately, dietary recommendations do not hit the mark. When you make correct major changes in your diet and lifestyle, diabetes can be reversed. How simple to think of diabetes' origin as a result of following unhealthy diet and lifestyle choices. You are in control of whether or not you get that dreaded diagnosis. Diet is the single most important factor that leads to high blood glucose levels, insulin stability issues, metabolic dysfunction, high level of triglycerides and LDL cholesterol, the bad cholesterol. And diet can reverse this condition too. I know, because I did it myself. Rather than seeing lifestyle changes as a dreaded chore, I made a game of changing my habits. My lab work results are always good now. Diet coupled with exercise can create major changes in weight, blood pressure, A1C, HDL, and heart health. Losing weight is very important for diabetics, as losing just 5% of body weight is very beneficial for type 2 prevention. Following the guidelines offered in my Taming Diabetes Differently course will help you to reverse diabetes and prevent prediabetes from even getting it. It'll prevent obesity, heart disease, strokes, Alzheimer's, cancer, premature aging, and many other serious illnesses. The results, of course, will vary on each individual. My course will empower you to seize control of your health. Together, we can begin a lifetime of good health. Your life is in your hands. If you are diabetic, you must share with your doctor the changes you're making. Keep your doctor in the loop so he can monitor your medication and make any necessary changes. Please do not attempt to change your medication doses without consulting your physician first. And remember, I had lowered my A1C from 5.9 to 4.9 in just 6 weeks. So if you're interested in signing up for my course, I would be happy to work with you to make massive, wonderful changes in your life. That would be an honor to be able to help you with that. So once again, my name is LeMaster at tamingdiabetes@yahoo.com, or call 972-948-9976 and be sure to leave a message for me, and we'll get started on a healthy lifestyle and results for you. So I want to thank you for for tuning in to my Common Sense Living podcast today. I hope you enjoyed it and definitely learned something beneficial for you. So please leave a kind review and share this episode with your many friends and relatives. And be sure to subscribe. You'll find me where podcasts are. And I'll see you in another couple of weeks. And I probably won't be talking about diabetes that day. But stay tuned. I might have a wonderful surprise. All right. Thank you for joining and have a great day. Toodaloo. Thank you for tuning in to my Common Sense Living podcast today. I hope you enjoyed it, and I'm sure you learned something new. Please leave a kind review and share this episode with a friend. And be sure to subscribe yourself. You'll find me on iTunes, Spotify, and other platforms. And don't forget, we'll be here again next week with another insightful episode of Common Sense Living. I can hardly wait.